Hello and welcome. Today we're diving into the world of the digestive system to understand a serious condition called a liver abscess. We'll explore what it is, how it develops, how it's diagnosed, and the available treatment options. So, buckle up and let's get started. Let's begin by understanding what causes a liver abscess. Essentially, it's a pus-filled pocket within the liver. These abscesses are usually caused by bacterial, parasitic, or fungal infections. Bacteria are the most common culprit. These bacteria can reach the liver in several ways. One way is through the biliary tract, often due to conditions like cholangitis, which is an infection of the bile ducts. Another route is through the portal vein, which carries blood from the intestines to the liver. Infections like diverticulitis or appendicitis can spread this way. Direct trauma to the liver or spread from nearby infections can also lead to abscess formation. In some cases, the cause remains unknown, referred to as cryptogenic liver abscesses. Parasitic infections, particularly amebiosis caused by Entomoeba histolytica, are a significant cause in certain parts of the world. Now let's delve into the pathophysiology, or how a liver abscess actually develops. First, the causative organism, be it bacteria, parasite, or fungus, invades the liver. This triggers an inflammatory response from the body's immune system. White blood cells rush to the site of infection, attempting to eliminate the invaders. As these cells fight the infection, dead cells, bacteria, and debris accumulate, forming a localized collection of pus, the abscess. The abscess then grows, causing damage to the surrounding liver tissue. The body may try to wall off the abscess, forming a fibrous capsule around it. This capsule can make it more difficult for antibiotics or other treatments to penetrate the abscess, complicating treatment. Regarding epidemiology, liver abscesses vary in prevalence depending on geographic location and underlying risk factors. Pyogenic liver abscesses, those caused by bacteria, are more common in developed countries. Risk factors include biliary tract diseases, diabetes, liver transplantation, and immunosuppression. Amoebic liver abscesses caused by parasites are more prevalent in developing countries with poor sanitation and hygiene. The overall incidence of liver abscesses has been reported to be increasing in some regions, possibly due to factors such as increased antibiotic resistance and changes in medical practices. What are the signs and symptoms of a liver abscess? Well, these can vary, but common symptoms include fever, abdominal pain, often in the upper right quadrant, nausea, vomiting, and loss of appetite. Patients may also experience jaundice, which is a yellowing of the skin and eyes, fatigue, and weight loss. Some individuals may have an enlarged liver, which can be detected during a physical exam. In severe cases, the abscess can rupture, leading to peritonitis, a serious infection of the abdominal cavity, which can cause severe abdominal pain, rigidity, and potentially sepsis. How is a liver abscess diagnosed? A combination of clinical assessment and imaging studies is usually employed. Blood tests are typically performed to assess liver function, look for signs of infection, such as elevated white blood cell count, and identify any specific organisms. Imaging studies are crucial for confirming the diagnosis and determining the size and location of the abscess. Ultrasound is often used as a first-line imaging modality due to its accessibility and lack of radiation. CT scans and MRI scans provide more detailed images and can help differentiate between different types of liver lesions. Finally, aspiration of the abscess fluid is often performed to identify the causative organism through cultures and microscopic examination. This helps guide appropriate antibiotic or antiparasitic therapy. While there aren't strict classifications, liver abscesses are generally categorized based on their cause. We have pyogenic liver abscesses, which are caused by bacteria, amoebic liver abscesses, caused by the parasite Entomoeba histolytica, and fungal liver abscesses, which are less common and typically occur in immunocompromised individuals. Additionally, abscesses can be described as single or multiple, depending on whether there is one or more abscesses present in the liver. Treatment and management of liver abscesses typically involve a combination of antibiotics or antiparasitic medications and drainage of the abscess. Empiric antibiotic therapy, covering a broad range of potential bacterial pathogens, is usually initiated before culture results are available. Once the causative organism is identified, antibiotic therapy can be tailored accordingly. Drainage of the abscess can be achieved through percutaneous drainage, guided by ultrasound or CT scan, or through surgical drainage in more complex cases. Percutaneous drainage is generally preferred as it is less invasive. In cases of amoebic liver abscesses, specific antiparasitic medications, such as metronidazole, are used. Supportive care, including pain management, hydration, and nutritional support, is also an important part of the management strategy. Prevention strategies for liver abscesses vary depending on the underlying cause. For pyogenic liver abscesses, prevention focuses on managing underlying conditions such as biliary tract diseases and diabetes. Maintaining good hygiene practices, especially in areas with poor sanitation, can help prevent amoebic liver abscesses. Travelers to endemic regions should also be advised to drink safe water and practice safe food handling. Prompt treatment of intra-abdominal infections, such as appendicitis and diverticulitis, can help prevent the spread of infection to the liver. Avoiding unnecessary invasive procedures and ensuring proper sterile techniques during medical interventions can also reduce the risk of iatrogenic liver abscesses. The prognosis for liver abscesses depends on several factors, including the underlying cause, the size and location of the abscess, the patient's overall health, and the timeliness of diagnosis and treatment. With appropriate treatment, the majority of patients make a full recovery. However, complications can occur such as sepsis, rupture of the abscess, and recurrence. Recent research is focusing on improving diagnostic techniques, developing new antimicrobial agents, and optimizing drainage strategies. Some studies are also investigating the role of the microbiome in the pathogenesis of liver abscesses, which could lead to new preventive and therapeutic approaches in the future. Thank you for joining us on this exploration of liver abscesses. We hope this information has been helpful.